Good morning. Good morning, everybody. And welcome. Um, my name is Tony Eiton. I'm the Senior Vice President at the California Endowment. I used to be the Director of the Alameda County Public Health Department. And today, I'm pleased to be here to help moderate a great conversation about an important public policy issue, and a very timely public policy issue. And so I'm just going to say a few words, and then we're going to turn to these distinguished researchers to provide an overview of some of the policy support for this effort, and then we're going to have a question and answer session. For those of you who have too much coffee, there are bathrooms right across the hall, and we hope that you'll benefit from a lively conversation. So I'm going to start by saying something fairly self-evident, but something that we oftentimes don't think about. And that is the fact that poverty is not a natural phenomenon. Poverty is man-made. I'm going to repeat that. Poverty is not a natural phenomenon. It is man-made, and it can be unmade. Ironically, oftentimes through the work of women, but it is a entirely policy-driven phenomenon. And oftentimes the issue is the absence of policy in the face of abject need. So as we sit here today, right now, we're, as a society, manufacturing poverty in Oakland. We make it difficult for low-income people to find decent housing, to find reliable transportation, to access quality health care, to get access to good teachers in schools, to get paid sick days when they're ill or their family is ill, and to receive a decent wage to support their families. We do this. There's nothing natural about that. That's the product of our decision-making. There are immense social costs to poverty in Oakland. These costs are unnecessary, and quite frankly, they're cruel. Let me tell you 4 things that we know. We know that the economy has shifted. 60% of the jobs lost in the recent recession were middle-wage occupations, and they've been replaced with low-wage occupations. These low-wage industries not only have been the bulk of the recovery over the past 5 years, but they're anticipated to grow through the year 2020. We also know that income inequality is increasing. The value of the minimum wage has decreased over time. Wages in low-income households are worth less today than they were 40 years ago. Over 50% of fast food workers nationwide, over 50%, and their families receive public assistance. And many of those are full-time workers. That's outrageous. We also know that the cost of living has outstripped wage growth in the Bay Area. A minimum wage worker makes slightly over half, about 56%, of what's required to keep up with the cost of living in Alameda County. The Bay Area, as we know, is one of the most costly regions in the country. Oakland's housing market is booming. Rents are skyrocketing. In fact, in 2012, Oakland made Fortune magazine's list of the top cities with the highest rent spikes. And finally, as a physician and somebody who ran the county health department, we know that poverty causes profound health impacts. In Oakland, we know that the average life expectancy varies as much as 20 years. 20 years from one neighborhood to the next in Oakland today. That's the equivalent of having Sweden and Pakistan within a few blocks of each other. When it comes to your health, we know that your zip code matters more than your genetic code. The variable that most accurately predicts average life expectancy is income. In the Bay Area, every additional $12,500 of household income buys you a year of life. Working full-time, you should not have to be on public assistance, making impossible choices between food, rent, gas, and electricity. The best medicine for this problem is tackling the underlying root cause, which is income. A recent health impact study showed that the minimum wage in California, increasing the minimum wage in California would decrease chronic diseases and disabilities, decrease hunger, decrease smoking and obesity, decrease depression and bipolar illness, and prevent premature deaths of 100 lower-income Californians a year. So, we're presiding over the tearing of the fabric of our society right now, today, as income inequality increases. Families are facing greater and greater stressors to keep up with basic needs. While we've made some important strides in the implementing the Affordable Care Act, we now have 3 million plus Californians that now have access to reliable health care. We've made important strides with education funding around the local control funding formula, which has actually directed a proportionally higher level of funding to low-income school districts that face students with the greatest needs. Other communities have tackled the issue of the minimum wage and paid sick days. The question for us is, what choice do we make? Do we stand idly by and act as if we're helpless? Or can we design and implement affirmative policy that helps Oakland families obtain a measure of dignity, improves our local economy, and improves health and well-being of our low-wage workers? Our policy is a reflection of our values. We're much better and smarter than this. Please allow me to introduce several speakers now that are going to present the research behind the proposed initiative. First, we'll have Ken Jacobs, chair of the UC Labor Center. Then we'll have Jessica Milley from the Institute for Women's Policy Research, senior research associate. And we have John Jones, an impacted worker from Lift Up Oakland, who's Burger King security officer, who's here to answer questions as well. We'll have 10 to 15 minutes of press Q&A after that. Michael Reich, the director of the UC Berkeley Institute for Research on Labor and Employment, is also here. And then we'll close out with any other questions that people have. So, Ken Jacobs.
Good morning. So, Ken Jacobs, chair of the UC Berkeley Center for Labor Research and Education. Two of my co-authors on the study are here with us today, Dr. Michael Reich, economics professor at UC Berkeley and director of the Institute for Research on Labor and Employment, and Ian Perry, who's a researcher with us. So, what I'm going to do today is go through from our research looking at what would the effects be of the proposed minimum wage increase in Oakland on workers, how many workers, who they are, where they work, the effects on businesses, the increase in operating cost, and then how those businesses would absorb those costs. So looking at what happens in terms of reduced turnover, productivity, price increases, and then do a little comparison with other local living wage laws. So what's happened when other places have put these laws in effect, what's happened economically, and what does that tell us about what's likely to happen in Oakland. First, I want to say a little bit, which Dr. Eitan got into well, around putting this in some of the economic context. So overall, when we look at Oakland is in economic recovery. The economy is getting better. What this slide shows us is jobs in Oakland. And what we can see from this is the number of jobs in Oakland actually fell less than in the recession than in California as a whole, or in Alameda County, and that we're back up in terms of number of jobs close to pre-recession levels. Now, I should note that the unemployment rate for residents of Oakland is still higher than in the county as a whole, but they've been falling at about the same rate. Next slide. But while we're seeing overall in terms of the recovery around the numbers of jobs, we haven't seen the same recovery in terms of wages. And so, again, as Dr. Eitan mentioned, we've seen this shift overall in the economy around. We had middle-class jobs that were lost in the recession, more job growth in low-paying jobs coming out. So overall in the United States, wages for 70% of the population have stagnated or declined over the last decade. When we look at California as a whole, if we look at the real wages, inflation adjusted For the bottom 20% of the population, it's actually 12% lower than it was in 1979, according to a recent report by the California Budget Project. And we can see here from this slide that in all across Alameda County, you see the median wage is lower than it was in 2007. It's at 8.4% lower in Oakland, 10.4% lower in Alameda County. So, moving into our results of the research and what would happen with the pay increase in Alameda County. So first, we find as a result of this law, about 25 to 30% of Oakland workers would receive an increase income as a result of the proposal, an increase in pay. And that would mean that's about 40 to 48,000 workers overall who would get an increase in pay. Of those, about 30,000 are directly affected workers. That's people who currently earn less than $12.50 an hour who would have an increase as a result of the law. The remainder of those are people who earn slightly above the proposed minimum wage increase, and but who would get a pay increase because employers, in order to maintain wage differentials, will increase wages for people who earn slightly above the amount. So generally, if you look at the percentage increase of the minimum wage, about half, and cut that in half, or the dollar amount, add that to the minimum wage, you expect workers within that range at the top to get pay increases. Normally it's about 15% above the new minimum wage. So again, you've got about 30,000 workers directly affected, and between 9 and 14,000 indirectly affected. Next slide. Overall, in terms of pay increase, that's an additional $120 million in wages in the pockets of workers of Oakland workers in the first year. On average, that's an additional $1.69 an hour, and it's $2,700 a year on average for those workers. So those are some fairly large increases from the perspective of those workers. Each worker, an additional $2,700 a year on average, is really quite significant in terms of what that would mean for their ability to afford rent, to afford the basic living expenses. So who are these workers? There's a lot of, we hear lots of things around, people think of minimum wage workers, low wage workers. There's this sort of idea in the public, oh, this is a teenage workforce. Well, the median age of workers who earn less than the minimum wage or who would benefit from this law in Oakland is 32. 96.5% are in their 20s or older, and half are in their 30s or older. This is an adult population. More than a third are married, and more than a third have children. And the average effective worker contributes over 40% of their household income. This is not a question of people having these low-wage jobs as sort of extra spending money. This is money that is directly and significantly a part of household income. Next slide. This gives us a little bit on the demographics of the workforce. We look at workers of color make up 62% of the Oakland workforce, but 78% of the workers affected would be people of color, and 43% of the workers affected are Latino. So the biggest impact is in the Latino workforce. Next. When we look at family income, more than half of the affected families are in families with incomes under 200% of the federal poverty level. So that's low-income families. And in fact, 3/4 of the Oakland workers who live in low-income families would benefit from the increase. That compares to about 15% of workers who don't live in low-income families. So the law really does have its intended effect. Next slide. This gives us a little bit about, the majority are full-time employees, about 2/3 full-time, about 1/3 part-time. And when we look at industries, over half of the workers are in 3 industries. That's retail, trade, restaurants, and then education, health, and social services. And that would include teachers, assistants, childcare workers, etc. But when you look at this, where you see is the big disproportionate impact is in restaurants and retail trade, those areas where you have large numbers of low-wage workers. So then the question is, so what does this do to business operating costs? What does this mean for businesses, and how would these costs be absorbed? And what's important to note is when you look at, okay, you're getting across 18.7% on average increase in wages for those people who are affected, what's that do to business cost? Well, when you break this down, it's important to remember that not all workers in those industries will receive wages, and not all those workers are at the minimum wage, right? So you've got an average across. And so when you then look at in terms of overall payroll costs, it turns out that on average in retail, the effect on overall payroll costs is 2.4%. I'll read that, 2.4% increase on average in retail cost. But wages make up only 11% of retail operating costs. So the overall change in operating costs in the retail sector is 0.3%. Very, very small. Restaurants, you've got a much higher share of labor as overall operating costs, almost a third, 31%, and a greater increase in payroll costs, on average a little less than 9%. But even then, the overall change in operating cost from the increase is 2.8%. Again, a very small increase. And so when we look at the overall effect on businesses, it's important to understand how this comes down in terms of overall cost. Now, you have to say that that will vary across businesses within that industry. Some of them will have more low-wage workers, some of them will have fewer. So in a particular restaurant or particular retail store, that could be slightly different. So how are those costs absorbed? The research indicates that a higher minimum wage is absorbed in a number of ways. One is when minimum wages are increased, we see a decrease in worker turnover. So one way to think about this is we're going to talk about effects of minimum wage on supply and demand, right? And so the common story you hear is if you raise the price of labor, that you're going to reduce demand, but you've also got a supply side story to hear. And when you raise the price of labor, if you pay people more, they stay on the job longer and it affects their performance. So the reduced turnover translates into savings for the firm. You also have there's lots of good research in terms of indicators on workers' performance, in terms of less grievances, less absenteeism, better performance overall, better customer service. One of the surveys we did found less equipment damage, better equipment maintenance, better worker satisfaction. So overall, we estimate that those improvements can absorb about a quarter of the costs of the minimum wage increase. And then the other thing you do is see the rest tends to be passed on in terms of prices, but those are all generally very small increases in prices. We'll get back, and I'll go into that more in a second, but the previous studies, because of that's how those absorbed, have found very little impact on employment. So we studied the impact of the minimum wage law in San Francisco that's been around 10 years, and my colleague Michael Wright has done extensive research on the effect of minimum wage all across the country, looking over a 16-year period, and again, found no measurable impact on employment. Next slide. So when we look at the impact on prices, overall in terms of retail, again, because it's such a small share of operating cost, you're talking 0.2 to 0.3 one-time increase in prices. This is not a big price increase. So even as costs are spread into prices, they're spread over large numbers of people in very small amounts, while the impact on workers' wages for those workers is really quite significant. In restaurants, you end up with a 2 to 3% one-time increase in prices. That's equivalent to what we see in terms of annual increase in restaurant prices in general. This is a small one-time effect. Next slide. So overall, again, in terms of the employment effects, what this slide shows us is what happened in San Francisco in the restaurant industry after its minimum wage went into effect. San Francisco currently, putting this in context, both has a minimum wage law that went into effect 10 years ago, February, plus a healthcare spending requirement. All firms have to spend, with 20 or more workers, spend a certain amount of per worker per hour on healthcare. When you add that together, the effective minimum compensation in San Francisco is now over $13 an hour. And what you can see here, and we looked at this as well for overall employment, is employment patterns in general look like the rest of the Bay Area. You don't see an greater increase in, or less increase in employment in San Francisco. It looks like the rest of the Bay Area. And in restaurants, in fact, employment grew a little bit faster in San Francisco during this period than in the rest of the Bay Area. And Michael Reich's research in the rest of the country has found similar results. So, one of the other questions that's come out on this, all right, there's been all this research about other minimum wage laws and what their impacts have been on employment. What does that mean overall? How can we compare Oakland to those other places? Is this increase larger, smaller? How does it compare to what's been studied? Well, the increase in Oakland would be it's a 36% increase in the minimum wage. California will be up to $9 as of July 1st, and then of course California is going up to $10 minimum wage January 1st, 2016. So if we look at that first step from 9 to the 1225, that's a 36% minimum wage increase in Oakland. And just a second. And that really lies within the range of what we've seen in other local laws. Overall, the average increase in the 10 previous local minimum wage laws that have been passed is 43% in total. The ranges of increases in the existing 10 local minimum wage laws are 13 to 84%. So 36% is a little lower than the overall average that we've seen elsewhere in the laws that have been studied. The increase, if we look at this in terms of steps, the average step increase is about 17%, but the average first step nationally is about 22. So Oakland doing it in one step is a little bit higher, but again, it's well within the range of what we have seen in other cities. Another way that to look at this is to think about the minimum wage as a share of the median wage. So the median wage in Oakland is $22.64. 1225 would be 54% of the median wage. How does that compare to what we've seen elsewhere, where at its height, the United States, the federal minimum wage in 1968 was 55% of the median. This is again, it's lower now because we've seen the overall reduction in the value of minimum wage overall, but this is in range of what we have seen elsewhere. What we see in some places in the United States that have lower income areas with the federal minimum wage. So again, this is not outside of Oakland is well within the range of other proposals and well within the range of what has been studied. It's also important to note that one of the concerns might be, you'd say, well, what about Oakland going it alone, right? This is one city, and you're within a regional economy. And it's important to note San Francisco, there was just an agreement that there will be a ballot initiative in November that will raise the minimum wage in San Francisco to $15 an hour by 2018, and that first step would be the same in 2015 would go to the same rate as being proposed in Oakland. When we look at Berkeley, it is looking at a minimum wage of over $12 an hour. That will be voted on Tuesday. Richmond, California has went through its first vote on a measure that would raise that city's minimum wage to $13 an hour over time. So what we are seeing is, not just in San Francisco, but in the East Bay, a number of cities are considering similar measures. Many of these some will likely be in place before the Oakland measure is voted on. And from media reports, other East Bay cities are considering raising the wage as well. So what happens with Oakland with this is really talking about creating a standard that is becoming the standard, will become the standard for large parts of the East Bay, and that's very important. So in conclusion, note that 40 to 48,000 workers would benefit from the proposed policy. The average worker would receive an additional $2,700 a year. And businesses will adjust, as we said, in the minimum wage through a variety of things in terms of reduced turnover cost, improved performance, and a small one-time increase in price, mainly in the restaurant industry. And as noted, Oakland is, again, well within the range of increases we've seen in existing minimum wage laws. And the research on laws with increases of the size that Oakland is contemplating have not found any significant impact on employment. Thanks, and at the end we'll be happy to answer questions.
Good morning. Well, I'm happy to be here to present the findings from IWPR's research on the paid sick days portion of the proposed legislation. And IWPR has been doing a number of analyses over the past several years on the effects of paid sick days legislation across the country. And so the analysis that I'm going to be presenting to you today deals with trying to estimate the number of workers that would be impacted by the paid sick days portion of the policy. And then trying to get at the overall composition of that workforce and the workers that would be impacted. So what is the racial composition? What types of jobs do these workers tend to work in? And how does this access to paid sick days vary by the minimum wage part of the bill? So our findings suggest that overall, about 37% of workers in the Oakland workforce currently lack access to paid sick days, even a single paid sick days. And so our estimated number of workers who would be impacted by this part of the legislation is somewhere between 56,000 and 57,000 workers in the area. In terms of the gender and racial breakdowns of these access rates, we don't typically see a lot of variation by gender and race, with one notable exception of Hispanic workers. And 52% of Hispanic workers in the area are currently estimated to lack access to paid sick days. We also see a little bit of variation by the age of the workers in the workforce. And the very large portion of workers who are currently under the age of 30 would be impacted by this legislation. So 57% of workers under 30 currently lack access to paid sick days. It is a little bit more surprising when we look at this breakdown by industry of employment. Next slide. We see a lot of variation in access rates to paid sick days when we look at the industry of employment for our workers. And what's particularly shocking is that workers who are in industries that have a lot of contact with the public, a lot of those workers currently lack access to paid sick days at all. And so you'll see the industry that has the lowest level of access is actually one of those industries that has a very large number of workers who have interactions with the public on a regular basis. So food service workers, workers in the accommodations industry, arts, entertainment, and recreation, 71% of those workers are estimated to lack access to paid sick days. And that has a lot of public health implications. So these workers are potentially faced with this decision: do I go to work when I'm sick and try and get my paycheck for the day, or do I stay home and take care of my health? And so evidence has shown that workers who currently lack access to paid sick days, they're 1.5 times more likely to go to work when sick than workers who do have that benefit. And so when you have 71% of workers in those industries that have a lot of contact with the public, that's a lot of workers who are going to work sick and not only infecting their coworkers, but also potentially passing on that illness to worker or customers that they're interacting with on a regular basis. What is probably more interesting, given the nature of the legislation that's being proposed, is how this access to paid sick days varies by the hourly wage of the workers. And so we used a methodology that mimics the UC Labor Center's methodology in breaking down the impacted workers. And we found that workers who would be directly impacted by the minimum wage part of the bill, 68% of those workers who are low wage currently lack access to paid sick days. And so this is particularly important because these workers are also those workers who are likely to be working in those industries that have low access rates. So again, the food services and accommodation industries. So not only are there those public health impacts, but there are also economic impacts for those workers as well, because these workers are more likely to face that dilemma of going to work and getting a paycheck or staying home and taking care of their health. So just a note on our methodology and how we obtained these numbers. We utilized two different data sources. One was the 2011 and 2012 waves of the National Health Interview Survey. We use that to model access rates to paid sick days to determine what kinds of characteristics impacted whether a worker had access to that benefit. So we looked at age, gender, race, industry of employment, income, and so forth. To get closer to the Oakland level of analysis, we utilized the 2012 wave of the American Community Survey. And so that allowed us to get to the Alameda County level, which we then adjusted downward to Oakland using relative employment data. Okay, so clearly there is a need for paid sick days legislation in the area. 40% almost of workers in the workplace currently do not have access to this benefit. And there are a number of benefits that can be had because of this legislation that we're not immediately seeing. So there's the obvious public health impact. So we're reducing the spread of illness in the workplace. Again, workers without access to paid sick days are 1.5 times more likely to go to work sick than those who do have that benefit. So they're spreading their illness to their coworkers and any customers that they're interacting with on a regular basis. This feeds directly into productivity impacts, which the firm is going to care a lot about. So evidence has shown that workers who go to work sick perform more poorly on a variety of their daily tasks than healthy workers do. And some research has shown that this impact on productivity is upwards of 50% of reduction on that productivity. Employees do value benefits that employers provide to them, and paid sick days is no exception. And so when workers are happy with the compensation that they're receiving, the benefits that they're receiving, they're less likely to leave the employer and search for a different employer. And so previous research has suggested that the impact of paid sick days on turnover is about a 25% reduction in turnover for those workers. There are also not just workplace benefits, but also community-wide benefits of having paid sick days legislation. So we could have impacts on children as well. So paid sick days can be used to stay at home when you have a sick child versus either leaving that child at home alone or sending them to school or daycare when they're sick. And so when workers are able to make that choice and stay home with their children are able to stay home, they're able to recover more quickly from their illnesses, which then could have some impacts on their overall education. They're able to function better at school, they miss fewer days overall when they're able to recover more fully when they stay at home. And lastly, we can have reduced emergency department visits. So paid sick days can also be used to go to the hospital for a doctor visit. Whereas if you don't have that benefit, you may wait until after work hours to go to the hospital to see a doctor, where you might be forced to utilize emergency department visits, which are much more costly. So a national estimate done by IWPR in 2011 actually estimated that 1.3 million emergency departments per year in the United States could have been avoided if we had a universal paid sick days policy. Now, a number of cities and states across the country have already enacted paid sick days legislation. So that includes San Francisco right nearby, Seattle, Washington, D.C., New York City, the state of Connecticut, and a number of others. And there has been some research done recently to kind of evaluate the impact of those policies on those areas. And what the evidence shows is that there has been very minor negative impacts on the area, and there have been some positive impacts as well. So we've seen that job growth has been stronger in areas that have adopted these paid sick days laws than the areas surrounding them that do not have those laws in place. So for example, evidence in San Francisco and Seattle showed that job growth in those areas was much higher than the growth in the surrounding communities without paid sick days legislation. In terms of employer costs, most employers surveyed actually showed either no increase in cost as a result of the paid sick days legislation, or a very minimal increase in cost that is less than 2% increase in total operating costs. And in fact, evidence from Seattle has shown that the overall cost of implementing the paid sick days policy was about 0.4% of total firm revenues for that particular year. There's also been some evidence that record keeping has not really been a problem. Most firms found complying with the law very easy, and only a third of them had problems implementing that policy. And finally, some firms have also shown some benefits of having this policy, such as improved employee morale and productivity. So thank you very much for your time. I'd be happy to answer any questions after this. And then I can also provide any information on the literature that I've been citing. You can contact me at millie@iwpr.org.
Okay, great. So now we're going to open up for some questions. I'm going to ask Dr. Michael Wright to come up here and sit at that chair over there. And, hopefully we can move forward some affirmative policy here in Oakland. We're the only Western industrialized country that doesn't provide some mandate, some sort of paid sick leave, which is outrageous. I mean, we've known about the consequences of that since the beginning of the last century with Typhoid Mary. So it's time to act. Questions for any of our panelists? Yes.
So the particular inflation rate you use, so if you're going to peg the minimum wage to an inflation rate so that doesn't erode over time, the particular rate matters a lot, right? So if you use, I think the Oakland one is using the urban worker clerical CPI for San Francisco, Oakland, San Jose. I think San Jose's minimum wage uses actually the US average rather than the regional average. So it actually, the value of that wage doesn't increase as much as the value of the proposed Oakland minimum wage would. So what particular CPI would be best to peg this to accurately reflect cost increases in Oakland, and which CPI might be best to actually maximize the value of the minimum wage, regardless of what accurately reflects Oakland?
So the overall reason to have it adjust to index to inflation is so that the buying power of the minimum wage is maintained over time. And that has obviously a real benefit for workers, because that means that workers, their buying power is maintained, but it also has some positive effects for employers. What happens when we don't have indexing is we get into the point where the minimum wage is devalued and then raised a bunch all at once, and this creates greater predictability for employers as well. In terms of which index to use, San Francisco uses the Bay Area CPI. That it's logical for Oakland to use that as well, because that reflects what the cost of living increases are for workers, people who are working in Oakland, live in Oakland or in the rest of the Bay Area. So that is a smart direction to go. It's important to note nationally, of course, that wages have not kept up with rising productivity really since late 1970s, early 1980s. You've seen this big gap between wages and productivity growth, and so indexing done this way means that wages will keep up with inflation. There's another question about keeping up wages with median income or keeping up wages with productivity, but that's a longer discussion and another day.
Yeah.
John is sitting up there. You said John is a security worker at a fast food restaurant. I haven't heard from you. I'd like to hear your thoughts on all this and how it affects you.
Sure, thank you for asking. My first day at work at Burger King as a security officer, I was ill. I was very sick. But I was not in a position to say, no, I'm not going to start this job. Because first of all, I went 18 months without a job. So as I went there, mindful, as my colleagues here are sharing with you, when you work in an industry where you're dealing with the public, you are at risk of spreading or passing on this illness to others. With that being said, I'll give you another example, not just to use what happened with me. Just last week, I had a coworker who was standing in the kitchen. She's a cashier. And she was swerving and swaying. It's a good thing I paid attention. I ran over and I grabbed her before she fell. We have a hard ground. Come to find out she was pregnant. But she knew before she came to work she was ill. She already knew she was sick. But the reality is she could not afford to stay home. She needed money. By not having paid sick days, she literally was at risk. She could have possibly died as a result of hitting her head on that ground or hitting her head on the sharp angle of the corner. The point is, this is needed. It's very necessary. For people like myself, making $10 an hour, I don't have enough money to take care of the necessities. I have 3 face towels in my house. So now I'm forced to either A, use this dirty towel for 2 weeks, or B, attempt to do laundry every week, which also costs money. I'm standing before y'all today. I just found out today my PG&E got cut off, just today. This is real. This has a real impact. In my bedroom, because of the poor insulation of the window, I don't even have curtains. I have a blanket, and I put a sheet over that. Oh, that's fine in the summertime, but when wintertime comes, what do I have to do? I have one blanket on my bed, I have one in the window. Do I put both blankets over me, or do I keep the one over me and one in the window? Any way it goes, I'm freezing. Ultimately, this is about human dignity. Everybody has a right to have a job, to pursue the American dream, to come home at the end of that day, to feel good, that you have the ability to put food on the table. And let's get real practical here, everybody. Low-income people do not save money. We cannot afford to. I'm at $10 an hour right now. At $12.25, that will give me more spending power to go out and buy the things that I need, like curtains for my bedroom window, like more face cloths for my closet, for my home. This will have a great impact on local businesses because that's what we do. We shop. We have to buy things. That's not enough money to save. No one's going to get rich. I'm not going to buy a house in the Montclair district. No respect to anybody who lives there, but that's not going to give me the funds to do that. But what it would do, it would, first of all, it will allow me to feel better about the job that I have. Because it's bad enough to do a job that's not appreciated. As a security officer, I am dealing with some wonderful people in the city of Oakland.
All right.
I'll just say that.
All right.
But the money's not enough. It isn't. But I have no choice. I have to do what I have to do. So right now, I am so happy to stand up here, and I'm so happy to say and to share that over 33,000 registered voters in the city of Oakland have stood up and said, enough is enough. We need more money for our people, and we need it yesterday.
That's right.
We don't need no gradual increase. That is not going to help me.
Right.
I have a child on the way right now as we speak. And I can't begin to tell you about the nightly sleep, worrying about how I'm going to pay for diapers and things like that. But I can guarantee you this. $12.25 was a start to make me get a little bit more rest so I could be more productive on my job. Thank you.
Other questions? Yes.
Yeah, for Mr. Jacobs. A lot of your presentation talked about the retail and restaurant sector, but I think your data here says about 10% is manufacturing. And is there any data that talks about to what extent there's been a shift of light manufacturing out of municipalities with newer minimum wages to the next city over, et cetera, like Hayward or San Leandro? And secondly, in the case of nonprofits, is there any data about how minimum wages have affected nonprofits?
Yeah, excuse me.
Just to the mic, please.
Yeah, those are both excellent questions, which we have to worry about. Oh, yeah, sorry, I'm Michael Reich from UC Berkeley. Good questions, and the things we do need to worry about. Manufacturing is especially mobile in a way that restaurants are not, and so it's important to know what the effects are. But in fact, most manufacturing is paid well above the minimum wage. So we don't really see that effect. I've studied, as Ken referred to, pairs of counties across the whole United States that straddle a state border where there's a higher minimum wage on one side than on the other side. And overall, we couldn't find any change in employment, firms leaving. And if I found that a lot of manufacturing firms were leaving, I'd be worried about the the method of my study, because they're the least likely, given their wage rates. Excuse me. And the other question on nonprofits, it's always surprising to me how many of our nonprofits pay low wages to begin with. And it's kind of what's going on here. The San Francisco law that was passed in 2003 allowed nonprofits an extra year to adjust to the higher minimum wage. And also they were, most of them I think were funded by the city or the state. And so that gave them time to get higher, renegotiate the contracts at higher rates. And I think that's the typical experience. The foundation, some of the money also comes from foundations. So I know the nonprofits are particularly strapped in this situation, but I think they've done okay in San Francisco.
Just to add on the nonprofit side, I think it's really important. You're looking at both the question of wages and understanding in certain nonprofit situations the question, okay, so where's the increase going to come from? It's really important also to look on the productivity and turnover side. So in San Francisco, we just recently put out a book on when mandates work, raising labor standards at the local level, that looks at all of these things in detail. And there's one chapter in the book that focuses on what happened on in-home supportive service workers. And we've got to recognize that in terms of the nonprofit social service workers, the work they do has a big impact on their consumers. So in the case of IHSS, a big impact on whether or not those consumers are able to stay and live independently or end up in more costly nursing homes. And what we found from the research is the higher wages in San Francisco for IHSS workers meant a reduction in turnover of workers, and that has very positive effects. There's a lot of well-documented research on sort of better jobs, better care. And so when we look at the nonprofit sector, understanding the fiscal issues are real, there's also an important issue here in terms of what it means for overall care within those industries as well.
A couple of questions. Good morning. Looking through the slides, particularly Mr. Jacobs' slide, what is the definition of an Oakland worker?
The definition, good point. So the definition of an Oakland worker here, we're looking at people who work in Oakland. So if we look at, of all of the Oakland residents who work, 45% of them work in Oakland. And of all the people who work in Oakland, 40% of them are residents of Oakland.
I'm sorry, make the distinction. I thought you were going to say they work outside of Oakland.
So 60% of the people who work in Oakland live outside of Oakland. 45% of Oakland workers, so people who are residents of Oakland, live in Oakland and work, 45% of them work in Oakland. So you do have people who live in Oakland, are workers, and are working in San Francisco and Berkeley and Emeryville and the surrounding areas. And we have people who work in Oakland who live in the surrounding areas. This is a region. And that's partly why it's important that we're saying not just Oakland look at this initiative, but the fact that San Francisco will be raising their minimum wage to $15 an hour, or likely to raise their minimum wage to $15 an hour. There are many residents of Oakland who work in San Francisco who will benefit from that increase, and the fact that other surrounding cities, Berkeley, Richmond, and likely others, are also considering increases.
The other question that I had was the impact on unemployment. You referenced in your presentation that Oakland continued to have a higher unemployment rate, even as those early slides when you looked at the level of employment. I'm curious if your research has looked at the impact of unemployment when the minimum wage changes in these other communities. If there is a concern of double-digit unemployment in the city, which is a greater threat to health than the lower employment. So I'm just curious, because you did reference kind of parenthetically that this, so what was the correlation, or what did you see happening with the unemployment?
So overall, important to say, again, with Dr. Reich's research, looked at this in detail, you don't find from minimum wage increases negative impacts on employment. So again, looking at these paired counties all across the country, so how does Spokane do to Coeur d'Alene, Washington and Idaho? Washington has a $9.32 minimum wage. Idaho is at the federal minimum wage, is at $7.25. You've got a pretty big differential there. you can't find negative impact, you don't find the negative impacts on employment from raising the minimum wage. Unemployment is a harder measure to look at because when you raise the minimum wage, if more people come into the workforce and want to work because wages are higher, then the unemployment rate is of the people who are looking for work, how many of them can't find work. So if because the rate goes up, more people are looking for work, it's unclear what unemployment is a measure that doesn't really tell you much in terms of what all's happening. The important measure to look at is what's happening to the numbers of jobs. And here you don't find a negative impact on the numbers of jobs.
Okay, then my last question is differentiating in those sectors, the mom and pop shops. You've addressed the issue of home health care, the IHSS, and the nonprofits, but particularly on the restaurants, the owner-operators, were you able to drill down on that level? Because you did say that there would be differentiation. I'm concerned now about minority-owned businesses in particular, whether we're looking at, say, like Chicken and Waffles or the Nellies, these minority-owned businesses and the impact on them, because what they're reporting to me is, as a total cost of operating, labor is like 60% of their operating costs, so.
So I don't know if, Mike, you want to say something here, but, excuse me. Overall, when they did the research on San Francisco and what happened when minimum wage increased in San Francisco and looked at what happened in restaurants in San Francisco and Alameda County as a comparison point, you didn't see any different change in restaurant size, for example. So some of these things are hard to drill down into, get as narrow as you might want to get. But you didn't see, say, small restaurants going out of business and then a move towards employment towards larger restaurants. It's not just that employment didn't change relative in the two places, but the size of firms didn't change either. So there was no evidence of a differential effect on smaller businesses, is the key point.
Let's go over there. Yeah.
Good morning. In Seattle, when they voted to raise the minimum wage to $15 an hour, they found that it took 4% of their population out of poverty. Have we done any analysis of the cost savings to the county, to the cities, in not having people maintain in poverty?
Do you want to introduce yourself too?
Councilperson Desmond Brooks.
I've done a national and also state-by-state study of what happens when you raise the minimum wage to the number of people who have to go on food stamps. And there's definitely a big reduction, as you might expect, but it's not that obvious because if the minimum wage state created more unemployment, your question, then you'd see more people on food stamps. Yet we do find a big decline. And I think people would prefer to have a wage rather than get their income from food stamps. I'm about to release in a couple of days a study that does the same for Medicaid. It's a little more complicated because there are more moving parts because some states have expanded their Medicaid programs, as has California. Some states have not, and so we're still wrestling with how to analyze it overall. But definitely the taxpayers are going to be paying a lot less when there's an increase in the minimum wage. I'll give you just kind of a sample numerical answer. If the minimum wage went up to $10.10 today in the whole United States, and take into account all the differences we already have in the minimum wages by states, the federal taxpayers would save about $4.6 billion each year.
Okay, we have time for one more question. Okay, we have time for no more questions. Our panelists will be available for anybody who wants to do any one-on-one. Thank you for being here. Let me remind you, poverty is not a natural phenomenon. This is a man-made phenomenon. We can change this. Thank you for coming.
know my supervisor went to the survey, so.
Sorry.
But I'm not able to.
And the second thing is that, but that's not going to be on the stage. That's really different. And so I'm just saying, what the city
He hasn't started working on the CD that he's dating.
I was trying to make you proud.
I got statues.
My information was in the slides. I met with County Council. Nice to meet you.
Keep it up. You're doing great.
Your information.